Alright, so I'm doing a video for complex wound. I'm going to demonstrate the abdominal wounds. So the abdomen and the thigh are the same, except with packing the thigh, you only use one 4x4 gauze. Packing the abdomen, you use two. So I'll explain that further when we get to that point. The other option on orders is going to be the foot for complex wound, and I'll show you another video for that, okay? So I just want to do the procedure. I've already done hand washing, identified my patient, all of those things. Supplies you will need: 2 pair of clean gloves, biohazard bag, a pair of sterile gloves, tape, 35 ml syringe, your angio cath, measuring device, ABD pad, a pack of gauze, not the little 2, this has 12 in it, of the 4x4s, and then 3 packages of cotton tip applicators. First thing I want you to notice is my setup. So my table is straight in line with my wound, okay, so that I'm not turning my back on either sterile field at any point. So my wound's a sterile field, and then also my setup is going to be a sterile field. I have my trash can here. Don't really need my trash can, because what I'm going to do is use my biohazard bag for this. So you will tape up your biohazard bag. Use your bedside table, the part with the pole. Take your biohazard bag to that end, not the free end, because their free end you want it to hang over your bed. Sometimes for these checkoffs I leave the biohazard bags on the table, so it just kind of depends on my mood or Ms. Cavasos' mood, if that's already going to be set up for you. Timers will be set. This is a 20-minute procedure, so we expect you to stay in that 20-minute range. All this up here. Alright, so first thing we're going to do, you can open 1 pair of your cotton tip applicators, but remember, open everything sterile, so I'm not touching it. Put on a pair of clean gloves. We're going to remove this old dressing. Same way you did with clean. You just pull up and tuck that tape in so it's not pulling on your patient as you go. And then we're going to try to grab everything if we can, and we got it all. Alright, so we have our drainage and our packing. So we've got probably 95% saturation on 4 of the 4x4s, because I have 2 for packing and 2 that are covering the wound. I'm going to double glove this and dispose of it. Okay. Put on another pair of clean gloves. I'm going to get my Q-tips. So there's 2 in a pack. My first Q-tip I'm going to pull out. I need my measuring device. There is a measurement in centimeters on the side of your packet here, or you can use this. So first I'm going to measure length, and I'm not going over the wound with my Q-tip. Even though it's sterile, I'm not going over the wound. So I'm just looking at the tip of my Q-tip coming over here, and that is going to be about 13 centimeters. Now I'm going to cross my wound to do my width, but I didn't cross my wound for the length, so this is still considered sterile. So go over my wound there, and I'm not hanging out over my wound, I'm off to the side, okay? 13 by 3. Throw first Q-tip away because it crossed the wound. Second Q-tip. Going to do my depth. Again, don't come on top of the wound, come off to the side. 3. And then I'm going to check for tunneling. In tunneling, you just go push into the sides of the wound. Okay, pull that Q-tip away. Now I'm going to palpate top to bottom on both sides. Okay, very good. Move those. Now I'm going to set up my sterile field. You can use a towel drape under the thigh. We will use it under the heel, but for the abdomen you don't really need it. Now your sterile field is going to be the wrapper of your sterile gloves. Now on sterile field setup, I saw a lot of people really touching. They're very handsy with their sterile gloves. So make sure you don't do that, okay? I'm going to get all of my packages open and ready to go onto my sterile field. And I'm not exposing anything, but I'm going to open it all the way around so that it's not difficult, because you're going to do it one-handed. One hand is going to be in a sterile glove, the other hand's going to be free to touch clean items. You know what? I need my sterile water, but I didn't get. Pretend like I didn't forget that. So this check off, your failure is in your setup. If you do not set up and plan for this procedure, then you're not going to be successful. So think about what you're doing. Open my angiocath by just breaking the seal and loosening it. Same thing with my 35 ml syringe. Just break that seal and loosen it. Bottled water. Sodium chloride expires December 2018, and it's a fresh bottle, so I'm going to date time initial because I'm opening it now. I'm going to organize everything the way I like it for setup. Your ABD pad, you can open it or leave it to the end. Your wound will be covered, so you could remove your sterile gloves and get your ABD pad then. I just like to have it available because I don't mind working with my gloves on. There are several ways to do this. Some people hang the Q-tips on the side of their table. Some people just leave them in the package and don't tape them down. So you'll find your own way with practice, okay? Just checking, make sure I have everything because I feel like I'm forgetting something. Now, your glove wrapper is your sterile field, so do not touch all inside your glove wrapper. You have 1 inch, okay? So what we're going to do is put one glove on. It doesn't matter whichever you prefer. I always do my dominant hand, but you may find it's easier to add your items to your sterile field if you do it on your non-dominant. Okay, so that hand's sterile, so now I'm going to add items to my sterile field. So first thing I'm going to add, without crossing over, Q-tips. Now want you to notice how I'm doing that. I'm not touching anything on the inside of the wrapper with my hand. I'm just pulling up with my clean hand, I guess. Now this one's a little tricky. I'm going to come over so I can show you. So the pink part of the cover is going to be knocked off while I'm not touching any of that clear part because that's sterile. Pull it out. Now when I put my angiocath on my syringe, I'm only putting on this plastic part. I'm not putting the needle, okay? But adding it to my field, I'm going to leave the needle on there. So just pop that off. Around, already read everything. Remove my cap. Open my tray. You want a good amount for that because we will be using that water. I'm going to move my tray over. The inside of this tray is also part of my sterile field. So I have my wound, my glove wrapper, and this tray is my sterile field. Now this, you can add it to your sterile supplies now if you want to, which I'm going to do, or you can wait till the end after you've removed your gloves. Okay. All right, so now I have all of my supplies. I'm ready to put on my other glove. ABD pad on the bottom. Alright, so the first thing I'm going to do is draw up saline in my syringe. You don't need that much, this is to irrigate. Okay, I'm going to remove my angiocath. My sharps will go in the sharp box once I've finished my procedure and I'm cleaning up. So it's a lure lock, meaning it just screws right on there, and I'm going to irrigate. Okay? Now I'm wicking, which means I'm going to put my gauze into the wound and draw up any excess of moisture. And you cannot touch the edge of the wound when doing this. So just go straight down. Any of that water up there. Okay, now I'm going to do the little wontons or pillows like we did for clean dressing. Now my packing. So like I said, we're going to use 2 4x4 gauze for packing of this wound. So I open them up, get them saturated in your water. Clean them out and clean up here. There are several ways to do this. Some people do not think a tight roll is good. They think it kind of wiggles out on them. So you just, again, find your own method. Now, this is color in the lines. We're going back to preschool. So this gauze can be as tall into the wound, as poofy, puffy, whatever you want to say, into the wound. But it cannot go outside the edges of the wound or it's contaminated and I need to get a new one, okay? So the first gauze wrap is fairly easy. Okay, so So you can see it's kind of standing high in the wound, but it's not outside the borders of the wound. Okay, there we go. Now no drop technique on covering that. And just let it fall where it falls. Do not move it around, okay? My AVD pad. And like I said, once that no drop wound is covered, I could have taken my gloves off, opened my AVD pad and put it on. And same thing with the tape. I could remove my gloves for that if they're nice and dirty, or if I just don't like tape with this. So I'm going to tape this up, date, time, and initial that, dressing change, and throw this in sharps.